This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Fourth leading cause of death in the United States. Sound pretty important to you? Well, we're talking stroke, a sudden attack on the brain.
Yeah, May is Stroke Awareness Month, a time to learn about the symptoms of stroke and how you might be able to help save a life. Dr. Clark Willis, Medical Director at PRMC's Robert T. Atkins, MD, Emergency Trauma Center, joins us this afternoon. And Dr. Clark, the statistics are staggering. I did not realize the fourth leading cause of death in the United States.
It is, and it's the #1 leading cause of long-term disability in adults.
Wow. Now, you were explaining to us, explain again real quick what a stroke is.
Well, stroke is where you lose part of your brain related to circulatory function, i.e. that the most common cause is that you have a clot that forms and you don't get blood to that part of your brain and it dies. But also if you have a blood vessel that breaks and you have blood inside your brain, that's also a type of stroke.
So that works that way as well. Are there symptoms that we can look for?
You know, most commonly people lose function. They either have weakness or numbness, they lose ability to speak, and other things of that nature.
Mm-hmm. So sudden numbness, weakness, trouble seeing. What are some of the other symptoms that we look for?
I mean, it can be, you know, very pronounced, and people can lose control of one half of their body. It can be more subtle, where they have speech difficulties or balance difficulties, and often it's a family that knows them that notices the more subtle things, as in they're not acting right.
So this isn't something you should just brush off, but pay attention to it.
No. No, one of our messages that we try to get out is the sooner that you can get to the hospital and get seen and evaluated, the more options we have for treating stroke.
And this is something that affects people of all ages. I guess I've always associated stroke with older people, but there's no particular age.
Your incidence or your risk goes up with age, but we certainly see young people who tragically have major strokes.
We just had a friend, which I guess you could say is relatively young, in his 30s, that had a stroke. So is there anybody that's more prone to a stroke than anybody else, other than just age?
There are certainly risk factors. Diabetes, high blood pressure, smoking are all risk factors. Sedentary lifestyle. If you have atrial fibrillation, where a condition where your heart doesn't, the top of your heart doesn't beat correctly, that set people up to have strokes.
So. Obesity, you said, physically inactive.
Yes.
Get out and exercise, do something.
Yeah,
yes.
Yeah. Now, if we suspect that somebody may be having a stroke, there's actually an acronym that you use to kind of determine whether or not that could be the case. Tell us about that.
Yes. You know, one is part of getting awareness out for the things that you should, that we would like to see you to be evaluated for, is FAST. Also around the idea that the quicker you get there, the more options we have for treatment.
Right.
But often...
Okay, so the F would be look for the drooping face?
Face, yes. Something very visual to people, and sometimes the first thing that you can see.
Okay. What about the A?
A is arms. The idea that people often have motor weakness or numbness, so if you get someone to raise their arms, if they have difficulty with one side versus the other, that can often be a sign of having a stroke.
Okay. The S?
S is for speech, and that if you can ask someone to repeat a simple sentence, if they struggle, you know, with a speech that they would not have struggled with before, that's another clear indication that we have a concern.
And T.
And T, which is really just about time. The idea that, you know, the sooner you get to the hospital, the sooner you get to the emergency room, the more options we have for treating you. You know, because strokes don't always have pain, and often people don't have pain.
Right.
You know, we see people that have a tendency to go lay down or take a seat or wait and hope that it gets better. And clearly, if they're actually having a stroke, that's not in their best interest.
So remember FAST: face, arms, speech, and time.
Yes.
And check those. I'm going to feel silly asking those questions, but it's for a good reason.
Yes.
So you never can. Is there anything preventative that we can do to try to avoid getting in that situation?
You know, certainly stop smoking if you're smoking, get your blood pressure under control, control your diabetes, you know, lower your cholesterol. Some people need to be on medications. For a lot of people, you know, changing their lifestyle, losing some weight, avoiding excess alcohol. And if you have a heart arrhythmia, making sure you have that treated and being on blood thinners if you need it.
Now, we were talking about time, getting to a hospital. There's actually possibly things that we can do or that the hospital can do to prevent further damage.
Correct. You know, one of the treatments that we currently use is TPA, which is like a clot buster medication or a blood thinner, aggressive blood thinner. And that can be given. Studies have shown 3 hours, if you get it within 3 hours of the onset of your symptoms, you're eligible. There's been some recent work that shows that maybe this window extends to 4.5, but certainly the further out you get, the less benefit you have and the more risk of complications that you have. It's not a magic bullet. It's not something that everybody can get and does not work for everybody, but for that option to be available, it has to be hopefully within that first 3-hour window.
As quickly as possible.
As quickly as possible.
Dr.
Yes.
Clark Willis, thank you so much for joining us.
Certainly, thank you for having me.
Appreciate the information, good stuff there.
And if you missed any of this important information, or for more information on PRMC's Stroke Support Group, go to delmarvalife.com and click on the Show tab. Well, still ahead on Delmarva Life, how about a weekend packed with food, drinks, and a whole lot of fun? More on Cambridge Main Street's 3rd annual Spring Fling.
And next, how about a summer of fun for the kids? We're going to tell you about Summer Fun Club Weeks at the Rehoboth Beach Boys and Girls Club, Delmarva Life. Live at its best here on Delmarva.